Moving on to dysphagia. You may remember we've talked about dysphagia several times when we were talking about other pathologies. Dysphagia was one of the symptoms, right? And dysphagia is still a symptom, okay? It's just that we gave it its own slide just to kind of point out that, to remind you that it is a symptom of a whole lot of different things. Difficulty, painful swallowing. That opens up, a whole lot of different reasons. If you look at here, the causes, everything from stress to literally strictures or narrowing of the esophagus. Add on there things like Parkinson's disease or any kind of neurological disorders that, if you think about that, remember back in the day when you were learning about how the esophagus moves food down it? What was that called? Squishes, squishes, squishes. Peristalsis, right? Remember when you learned about that? If you think about the coordination that has to happen from the nervous system to do that, right? That's quite a bit of coordination, which is why when people get older, and I'm talking like 80s and above, when they get older, then it's not uncommon at all for them to have difficulty swallowing because, again, everything is slowing down, everything's not as efficient. Nervous system is one of those things that's also included, and they just don't do peristalsis very well. They may have esophageal strictures, and that's kind of normal, okay? Also, closely related to that would be if somebody gets one of these neurological disorders, you got some kind of thing going on in your brain, in the central nervous system, and in many cases, depending on what we're talking about, Parkinson's, multiple sclerosis, Huntington's, all this kind of stuff that we'll talk about eventually here, is that, they're neurodegenerative diseases, and some of that is going to affect the esophagus. It's not uncommon at all. So, like I said, you can have a whole lot of different reasons why somebody could have difficulty swallowing, so kind of keep your mind open when you hear that as a symptom, because it could be a whole bunch of stuff, okay? Like I said, dysphagia, difficulty, or I think I may have said difficulty and painful swallowing, or painful swallowing, that's how we kind of use the word. Odynophagia, it's the same thing more or less. It's just painful swallowing. I don't know why we need another word, but you know how that goes. If one word in medicine's good, why not have two or three? Mean the same thing. Okay? Questions, comments? You may be asking, why is there a dog right here, but apparently that dog ate something or swallowed something. I don't know what happened to it. Okay. All right, tonsillitis. Not exactly a major pathology here, right? What are the most common reasons people get inflamed tonsils? Somebody comes in, they have inflamed tonsils. Where's your mind going? They're sick, obviously, right? Where's your mind going to go first? Seriously, staph? Okay. Okay, it's your mind, man. It can go wherever it wants. Okay, they possibly could have some kind of staph infection, giving them a tonsillitis. That's, by the way, not a great thing, right? It's one of the heavy hitters, yeah. Yeah. Again, try to get in the habit of looking for the horses instead of jumping straight to the zebras, right? Because, somebody's got a sore throat, they got tonsillitis, their tonsils are inflamed. Why? They're sick. They got some postnasal drip. Again, don't get tonsillitis necessarily confused with a sore throat, depending on which tonsils we're talking about, right? If you got the ones right at the back of the pharynx and you're postnasally dripping on them, right? Then yeah, it certainly could be. So again, look for the normal stuff, anything from a common cold to cold flu, and then we can start getting into maybe it's a staph, maybe it's a strep infection, right? Maybe it's Epstein-Barr virus, kind of things, right? Because it could be, and you certainly do want to eliminate those really bad things, okay? Okay. Remember when we were talking about leukemias and lymphomas? and we had some of those signs and symptoms, and even mono, right? So don't get too confused when you see, when we're just talking about tonsillitis. Pain, obviously. Lymphadenopathy, that one we associated more with what condition? The lymphadenopathy. Obviously leukemias and lymphomas, but if we're just talking about reasons for tonsillitis or sore throat, and we had a choice of strep or mono, which one are we associating lymphadenopathy closer with? With the mono one, okay? Remember that triad? It was way back in one of those slides with mono, what we talked about last time. Keep in mind your default. If it's like a flat out guess, let's go with, you see lymphadenopathy, let's guess the mono instead of the strep. Although obviously you can get lymphadenopathy with both. Okay. You see white patches, you think strep. Even though you could get them with mono, that's going to be your go-to for strep if you just have to guess. Make sense? Assuming the person just didn't have a cup of milk or something, right? Did I tell you that? That happened to me once. Did I tell you that? That happened to me once. Some lady brought her kid in, and I'm looking in the throat, I'm like, oh wow, there's a lot of white stuff all over his kid's tonsils and everything. She, oh yeah, he just drank this little sippy cup of milk. All right, let's try this again. Let's get some water and try and look again. Because, yeah, but sure enough, he just had milk in his throat. I'm like, okay. Anyway, don't have a lot to say about these sore throat remedies. You may have heard of them. You've probably heard of a lot more of them even than just these. The only thing I wanted to point out on here is most of the time when somebody has a sore throat, it is not bacterial, right? Honestly, most of the time it's probably allergies, but you know, I would put them in a category. Most of the time when somebody has a sore throat, I'm going to go with probably allergies and that post-nasal drip that Bethany was talking about. Maybe they're sick, common cold, common flu. I guess we need to throw maybe coronavirus in there now. Hopefully not. But anyway, you just kind of line them up on the most common kind of things first. Bacterial infections like strep, depending on who you are, that may be at the top of your list, because again, when we did our little unofficial survey, like half of you people have had strep, a lot, right? The only thing I want to point out on here at all was that honey apparently has some minor antibacterial properties, okay? So it's not going to hurt to have somebody, do a spoonful of honey or something like that. You'll notice a lot of cough drops actually have honey in them. If by chance it happens to be bacterially caused, it might actually help, okay, with the honey. If it's not bacterially caused, let's be honest, honey tastes good and it feels pretty good going down the throat when it's irritated anyway, so it's certainly not going to hurt. So that's pretty much the only thing I wanted to point out on that. Does anybody have any good stories about this? Or? Sure. You never know.
Tonsils?
I don't care. Give me a tonsil story. You got one?
Yeah. Mine was swollen up to the size of golf balls and closed my throat, which is why I had to get them removed at the beginning of the year.
This year?
Yeah.
They just randomly, so never before? They weren't already used?
They usually would swell up, but they would go down by the end of the day. But they weren't they didn't hurt, weren't itchy or anything. And then they swole up one day and closed my throat. And I had to go to the hospital.
Oh, dang.
Yeah.
I guess that is about the right time to get them out then. That's a little more serious at your age. Not that you're old. What are you like 18? 19?
I'm 21.
You're 21, really?
Yeah.
Oh, wow. That's going to be nice in about another 30 years because you're going to still look young. You got one of those faces,
Thanks.
But what was I going to say? I was going to say, when you're 21, that's a little more serious than when you're 6 and you get your tonsils out, right?
Yeah.
Did they warn you about that? It's a lot more bleeding, a lot more pain.
Yeah, for a while, if you cough or do anything super bad, you could reopen it. So I just kept reopening my throat. Yeah.
Yeah.
It was really sucked.
Yeah, I bet it did.
The drugs are nice though.
There's that. And that's why we have an opioid epidemic. Anyway, So, let's do a little mini case study. Concerned mother brings in her 2-year-old daughter to the clinic with the complaint of fever, irritability, and difficulty eating. That's not much. Based on what you've learned so far in class, what are the possibilities? How would you differentiate between them? So again, what's the first thing that comes to your mind if you just, somebody's coming in, 2-year-old, fever, irritability, difficulty eating? She's sick. Huh?
They're not eating, usually hurts to swallow.
Okay, not eating, hurts to swallow, or sick. What might you guess? Again, you don't know yet, you haven't done any tests, you haven't even looked at anything. What do you guess? What comes to mind? Strep? Why not? Let's go right for it. Again, you do want to eliminate the bad stuff, right? So, look in that throat and see. And of course, you can do your tests. Anything else? That's it? We got strep? We're like, yeah, person's sick. They got strep.
I mean,
Common cold, flu, mono. All right, good talk. Could be a lot of things. Let's move on. All right, patient with AIDS is most likely going to be diagnosed with which opportunistic disease? What?
Tuberculosis.
Tuberculosis. Why do you go to tuberculosis so fast? Because what? Okay, it affects people with low immune systems. Now, having said that, tuberculosis technically is an opportunistic disease. However, a big enough dose of TB in your face could overcome your immune system even if you don't have a bad one, right? Has anybody ever seen anyone with TB? Ooh, you have?
Yeah.
Got a good story? In South Africa.
They spit on the floor sometimes.
They spit on the floor.
Yeah.
Okay. I've seen that in a farm in Belvedere, Illinois.
Huh?
I said, I've seen that on the farm.
They still have an epidemic there
Uh-huh.
because they don't have, people don't have hygiene and stuff like that. No COVID. There's still have a TB epidemic in South
Okay.
It's just like a cough, but then they have
It's like a cough. We'll get back to that in a second here. Let's go over a little case study first to introduce it a little more. Jethro presents with a cough that produces purulent sputum. Jethro smokes 1 pack a week for the past 10 years. He's running a fever and he has night sweats. Chest x-ray reveals multiple granulomas. He also tested positive for a mycobacterium infection. So, what are the biggest clues in this? What are you looking for in this case study? What stands out? What's something you're like, Multiple granulomas. Do you know what multiple granulomas are?
thank you, go ahead.
Yeah, so I mean, it stands out, right? If it stands out, you're halfway there already. At least you know, it's like, oh, that's unusual. What is that, right? So we will learn about granulomas, okay? But yes, it is a big buzzword key point when you are talking about, what disease is this, by the way? TB, tuberculosis, right? So that's a big one. What's the other big one? What? Why mycobacterium? Why is that a big clue? Do you know what it is? Like half of you guys have had micro, right?
Isn't it the thing that causes TB?
Yeah, that's the category. Mycobacterium tuberculum or something like that, right? No, that's actually bacteria. That's the.
Myco means fungi.
I know it does.